Welcome to this training of the arterial line setup for the VA Emergency Department nurses.
We will review proper setup, zeroing, leveling, and waveform troubleshooting following VA policy and evidence-based practice.
An arterial line provides continuous monitoring of systolic, diastolic, and mean arterial blood pressures, and it allows for arterial blood sampling.
This is particularly critical for patients who require continuous hemodynamic monitoring or titration of vasoactive medications.
First, we gather our equipment from the procedure cart, drawer number 3, invasive pressure monitor. So this will have everything we need. Half-liter bag of saline, there's a pressure bag, arterial pressure tubing with the transducer. This is the pressure monitor cable that attaches to the Philips monitor. Here is a stabilizer for the transducer. And on the side of the procedure cart, if you'll come around, we have a leveling device. First, ensure all tubing connections are tight. Then, spike the bag of NS to first burp the air from the bag. Then spike it completely and squeeze the drip chamber completely full. Place the IV bag inside the pressure bag, but do not inflate it yet, as priming under pressure may cause air bubbles to enter the tubing. Make sure all your clamps are open. Then pull the flush mechanism to prime the entire length of the tubing. Then turn the stopcock off to the patient side and flush once more to prime the stopcock, before returning the stopcock open to transducer. Inflate the pressure bag to 300 millimeters of mercury or to the green bar. Take note of the diagrams on the back of the pressure bag to correctly position the stopcock for inflating, deflating, and maintaining pressure. Accurate pressure readings depend on proper leveling. Level the transducer at the phlebostatic axis, the fourth intercostal space at the mid-axillary line. This represents the level of the right atrium. Here I am palpating for the angle of Louis to find the second intercostal space, then walking it down 2 additional rib spaces and moving to the mid-axillary line. We place our leveling device to ensure a true horizontal, then raise or lower the transducer holder. Make sure to reassess with each change in patient position. Alternatively, you can co-band the transducer directly to the patient's arm at this same level. Connect one end of the pressure cable to the port on the arterial tubing, and the other side connects to the box on the Philips monitor. To zero, turn the stopcock off toward the patient side and remove the cap open to air. This reads atmospheric pressure, so we can zero the art line on the monitor before replacing the cap and returning the stopcock off to air in the neutral horizontal position. At this time, you can also replace the vented cap with the white non-vented cap provided in the kit to maintain a closed system. Now, when connected to the monitor, you should see a normal arterial waveform as shown. This is the square wave test to check transducer system accuracy. First, briefly activate the fast flush device on the transducer and interpret on the monitor. When connected to a patient, we should see a normal arterial waveform on the monitor, so nice round waves with one dichrotic notch. And a normal response to the square wave test is a square wave followed by 1 to 2 oscillations, returning to a normal arterial waveform. Now, an absence of oscillations with blunted waveforms indicates overdamping, whereas many oscillations with peaked waveforms with artifact spikes indicates underdamping. Both of these compromise the accuracy of pressure readings. So some common causes of waveform abnormalities include air bubbles in the line, kinks in the tubing or the roller clamp not completely open, loose connections, underinflated pressure bag or an empty saline bag, or your patient's wrist is flexed and it's kinking the actual art line. So what you can do to correct these issues is trace your line, flush any air bubbles out, remove any kinks or excess tubing, tighten any connections that are loose, make sure your transducer is properly leveled, and use an arm board if you need to in order to keep the patient's wrist in a neutral position. Make sure your saline bag and your pressure bag are in good condition.
Following these steps ensures accurate monitoring, patient safety, and compliance with VA policy and best practice. For more information, refer to Lippincott's Transducer System Setup.